So good morning, everyone, and welcome to this second session of our spectral.blue webinar in this series this autumn. There are still some people joining. I will just let them in. So my name is Karin Henriksson. I'm the Global Sales Director here at Lead Taylor and spectral.blue. I will be the moderator today, and as you have noticed, your camera is closed and your microphones are muted, but the chat is open. So please, if you have any questions, write them in the chat. We will have a Q&A session at the end of the webinar. There has also been some questions sent to me by email before this webinar. We will also answer to them. This presentation will be recorded and made available for later viewing. So let's have a look at today's agenda. So here you can see the agenda for today. So first of our CEO, Dr. Michelle Schmidt, will wish you all welcome. After that, we will hear Camilla Höglund, our lead scientist. She will tell us about how we can use blue light in clean room environment to prevent contamination. After that, our product manager, Tuukka Autio, will show us a few customer cases. And after that, we have a Q&A session and discussions. So, Michelle, the floor is yours.
Thank you, everybody. Thank you, Karin, and a big welcome from my side. This seminar series, we always try to show some benefits, describe a little bit about our technology, and as you heard today, we're going to talk about clean rooms. In clean rooms, one of the obvious benefits is savings. It's either immediate savings or a rapid return of investments. And this alone really makes our blue light technology an obvious choice for any clean rooms. And with that, I actually want to already give the word over to our lead scientist, Camilla Höglund. Please, the floor is yours.
Thank you, Michelle. And on my behalf also, welcome to our webinar, the second in a series that we will have this autumn. And today our focus will be on how to use our blue light technology in clean rooms to prevent contamination. I will spend some time to go through a little bit the basics of blue light and how it works and what kind of unique features blue light can offer to prevent contamination in clean rooms. We will also look a little bit closer on areas in clean rooms where we have identified a good place to use our technology, and also a little bit about Annex 1 and some highlights from Annex 1 that we feel that it's important to take into consideration. We will also talk a little bit about biofilms and how our technology can help you solve biofilm problems. We have worked quite closely with a lot of cleanroom customers and being able to hear a lot about their experience and a lot of the reasons why they have chosen this technology and why they want to use it in the clean rooms. For many, an obvious choice is that the technology offers a continuous use of disinfection, and you can be sure that the disinfection result is the same always, every day, and not dependent on human factors, human errors, or other challenges that might be in place. There is, I feel, a lot of emphasis also put on the use of chemicals And if there is an option to use less chemicals, this is something that many of our customers are attracted to. And the fact that it's UV-free, these together, both the fact that it's UV-free and it's chemical-free is also a matter of safety and less need for safety protocols, safety measurements in the premises. So for those of you who are not really familiar with blue light and how it works and how it's different to UV, I will spend a few minutes on talking you through the basics of it. Here you can see the spectrum of light, and the wavelengths that are usually defining UV light is 100 nanometers to 400 nanometers. And this area of wavelengths can be divided into UVA, UVB, and UVC. For those of you who are familiar with using UVC light in your clean rooms, you know, this is the most commonly used wavelengths are 254 and the so-called traditional UVC tubes that are, I think, the most commonly used ones. Our technology does not contain any UV light. We use visible blue light, which is defined as 400 to 500 nanometers. And for those of you who have been using the UVC tubes, you would know that, well, the tubes actually look blue to you. And that is correct, because the UVC tubes, although they have an emission spectrum, an emission maximum of 254 nanometers, they also contain some blue wavelengths, and that's why the UVC tubes look blue to the human eye. But UVC light in itself is not visible to the human eye. And the blue light that we are using does not contain any UV light. The way blue light kills microbes is very different to UV light also. Whereas UV light will break down DNA and RNA, blue light has a very different mode of action. What we know is that all microbial cells, and the round circle here can represent any bacteria, fungi, or yeast. And they all contain blue light absorbing compounds inside the cell as a part of their natural metabolism. And when they are exposed to the right blue wavelengths and high enough intensity, that's when different reactive oxygen species in the image marked with an orange as ROS, they will start to form in the cell, and as the name say, they have the ability to break down. They're very reactive, and they have the ability to break down basically anything that is nearby. So they can break down cell membrane, they can break down DNA, RNA, different protein structures, enzymes. And when this happens, the microbial cell cannot survive. This has been extensively studied, and our invention is around the fact that we know today that there are several different blue wavelengths that can kill microbes and activate this production of reactive oxygen species. And especially when you combine more than one blue wavelength, you can see a much more energy efficient and power efficient disinfection system. So using just one wavelength is not as efficient as using 2 or more. What we also are trying to get you thinking about is that disinfections should not only be a temporary effective solution that offers you the ability to reduce microbes, let's say 4 logs in 1 minute. I think this has been the emphasis and focus for a long time. And while this is important, of course, what we all know happens after this temporary efficient disinfection is as soon as the spaces or premises are being used, there are people coming in and out, materials being transferred back and forth, air coming in. This will also lead to microbials entering, getting back on the surfaces, and an exponential growth of microbial load on your surfaces. So having just a temporary disinfection solution, while it is efficient, is not enough. Because I think the aim, if you want to prevent contamination and microbes ending up where they shouldn't be, you need to have a disinfection solution that will keep your premises as microbial free as possible 24/7. And this is what our technology in many cases can offer, because it's safe for humans and materials. And we have been able to identify places where you can keep it on for many hours a day, perhaps even almost 24 hours a day with short pauses in between. This offers a whole new way of doing disinfection. And a bit later, you will hear some of our customer references and stories around this. So what we have been able to identify in clean rooms is a few good areas where this technology can really be used in the best way. Since we know that some of the most common, or actually the most common source of microbial contamination in clean rooms is or can be people flow, but also materials. So microbes enter via people or materials into your premises. And Annex 1 highlights that you should be using airlocks that will provide a physical barrier so that you can minimize microbial and particle contamination to spread between different areas. And these airlocks, material airlocks or people airlocks, changing rooms, are perfect places to use our technology because they're usually not in use 24/7. There is just short intervals in between when people come and go. You say transfer materials and equipment via these, but they are mostly empty, but they are a good physical barrier where you try to prevent microbials from spreading from one zone to the other or from hallways and other spaces into your production area. And some of the things from Annex 1 that I want to highlight and perhaps emphasis is, well, first of all, Annex 1, when it was updated in 2022, they have replaced the terminology of cleaning with cleaning and disinfection. So they are trying to really highlight and separate that cleaning and disinfection should be two different distinctive activities, and you try to achieve different things with cleaning and with disinfection. And it also highlights that the importance of cleaning is, first of all, to remove surface contamination, because in many cases when you use the disinfectant, surface contamination can lower the effectiveness of the disinfection. So that's why it's important that cleaning is aimed at removing surface contamination. But also, it's important that cleaning will remove disinfectant residues. Although it doesn't really teach you how you should move the residues, I think, at least I've been told that a good way is to wipe off the surfaces after cleaning with microfiber cloth that is a little bit wet, so that there is as little chemical residues as possible left on the surfaces. Because what we know is that chemical residues can be an excellent media for microbes that want to create dry biofilm and live in the dry biofilm. It also highlights that more than one type of disinfecting agent should be used. And it doesn't really, to my knowledge, state that what a disinfecting agent can be. I think it can be a chemical, but it can also be disinfection system based on light, which we are offering. It just highlights that it's very important that the different disinfection agent should be disinfecting with different modes of action, so that they are not doing the disinfection work via a similar mechanism. And this is something that our technology really can offer, a very different mode of action compared to chemicals, for example. But having said that, I think I want to take a few minutes still to talk about biofilm, because Annex 1, it does mention something about wet biofilm and biofilm formation in water system, but it doesn't really mention dry biofilm. And dry biofilm is something that has been discovered. I think it was first time described in 2012, but the definition of dry biofilm was perhaps established in 2015. And there are still many unknowns with the dry biofilm, but what we know with biofilms in general is that some organisms have more tendency to form biofilm, and when they are forming communities within the biofilm, they are usually much more resistant to biocides, and many researchers state that biofilms are quite often can be the reasons for surface disinfection failing or not being able to remove all the microbial load from the surfaces, because biofilms are very difficult to remove using chemicals and using UV. They also have a tendency to spread throughout, so their life cycle has been quite well established when we're talking about wet biofilm, and they tend to detach from surfaces and spread around in the premises. So once you have gotten some biofilm formation in your premises, it could be really difficult to get rid of. And dry biofilm is perhaps even more difficult because it's not really detectable, but by wet swabbing, it can be difficult to establish that you have dry biofilm formed up in your premises, but it's very typical that it will be formed in quite dry, sterile environments where you use a lot of chemicals. As I mentioned before, chemical residues on surfaces provides a good growing ground for these dry biofilms. And what studies have also shown now is that bacteria in dry biofilms can remain viable for even 12 months and more, even though there is no nutrients available. So this is something really to consider when you are planning disinfection in your premises. And also, I wanna end my part of the presentation with showing that there's a lot of studies on blue light being able to inactivate microbes inside biofilm. So here are some of the references, and if you want to know more about this, I'm happy to answer questions. Also, we have some customer cases and customer experiences with blue light being able to get rid of biofilms as well. But on my behalf, thank you for listening in so far, and I think now my colleague will talk you through some of the customer cases that we have in clean rooms. Thank you.
Thank you, Camilla. So my name is Tuukka Autio. I'm the product manager at spectral.blue, and like Camilla said, I will walk you through some customer examples of clean rooms, what we have done with spectral.blue blue lights. So I'm going to tell you about 3 different cases, 3 different companies. What's common with all of them is that, like Camilla said in the presentation, the one optimal place where you can use blue light is the airlocks or the cutoff rooms. And these all cases discuss different ways how blue light has been used to protect the perimeter around the production areas. So that's where blue light really shines. Our first case today is a global pharmaceutical company that operates in different markets, but they also have a production facility in the Nordics. And in this facility, they had observed elevated contamination levels in a cutoff room, a personal cutoff room that is situated between a laboratory and a production area. And they had tried different methods, all different chemicals, but could not get rid of the problem. So they wanted to test something new, and they contacted us to test blue light. So we arranged a test with them where we installed the devices in that single room for 6 weeks. And we observed the results for 6 weeks active use of blue light and 4 weeks afterwards without blue light. And in order to isolate the effect of blue light, the only thing that was added was the blue light devices, and all other processes, cleaning and chemical disinfection, was kept the same. So any change that you see should be caused by blue light and nothing else. The test techniques that they used were standard contact plates for surface sampling, and then they also used air sampling. And the research question that they had was, would spectral blue be able to reduce the number of microbes on the air and on surfaces? So let's have a look. So this is how the room looks. It's quite small personal cutoff room. People enter from the left from the laboratory side. They come in, gown themselves, and then exit to the right to the production area. And this room was equipped with 2 plug-and-play devices, the freestanding Berlin unit, and a Salo XL that was attached with magnets on the wall. And then there was a smart sensor box that had a microwave motion detector that would only turn the blue lights off and on based on people traffic in the room. The surface samples were taken from the red area you see in the corner based on a worst case scenario. So it was an area with the most shade and least blue light intensity. So they took a worst case sample to be sure that it works. And here is what the results look like. On the horizontal axle, you have the number of the sample, and on the vertical axle, you have the CFU count level. And as you can see, the first 2 weeks, they took samples every working day, excluding weekends. And after that, they had a routine phase of 4 weeks where they took 1 weekly sample. And after 6 weeks, they turned off the blue lights and took follow-up samples for 4 weeks. And if you look at the graph, what happens is that the trend started to go down quite quickly in the first week. And the microbe levels, we were able to push them really low and well under their alert threshold levels. But what was also very interesting was that when they eventually turned off the blue lights, the level didn't go up. So everybody was maybe expecting that, okay, now we take the blue lights out and the levels will go back up, but that didn't happen. So the effect that blue light had was actually persistent in this case. So like I mentioned, the new CFU levels were really low and well below the thresholds, and they persisted, showing that the continuous disinfection provided by spectral.blue was able to diminish contamination even in this kind of ultra clean environments. Then there was speculation that why did the effect not go away when they took out the blue lights? Well, this was not specifically tested, but the customer themselves were speculating that they, like Camilla said, they might have had a problem with dry biofilms in that room, which would mean that their standard normal cleaning practices could not penetrate the biofilm and could not get rid of that problem. But once they used blue light, they were able to eliminate the biofilms, and then continuing their standard cleaning practices could keep the levels down in the later weeks. But that was not, I repeat, that was not tested, but it's something that the customer themselves discussed as a potential cause. Our second case is a similar GMP certified production facility in Finland belonging to Next Pharma. So Next Pharma is a global CDMO company. The Finnish manufacturing facility is specialized in eye care and ophthalmic products. And they wanted to test spectral.blue in their perimeter areas, in one of their airlocks. So we arranged a test. And here the research question was that if we install spectral.blue in the boundary areas, can we reduce the number of microbes entering the adjacent production areas? And can we have an effect also on spore-forming microbes like bacillus? So this is how the test setup looks like in this case. So there were 3 rooms where they took samples. There's an equipment washing room, a material airlock, and a production area. In the picture, the rooms marked with blue shading were equipped with blue lights, and the production area did not. And they are using these portable pressure vessels with wheels that are pushed from lesser grade towards the production area. And they are first washed in the equipment washing room, then they are placed in the material airlock, and from there they are pushed to the production area. And the wheels of these pressure vessels were suspected to be one source of how microbes could enter the production area. So they wanted to test that maybe if we install blue lights in the washing room and in the material airlock, could that have an effect on the transmission of microbes towards the production. And in this case as well, no other changes were made. So they installed the blue lights, but all the same cleaning and chemical disinfection practices were kept the same. They took samples before and after installing the blue lights. The before samples were taken during 10 days, and they also took so-called worst-case situation testing, so that they sampled the room right after people had used it and before daily cleaning practices. And here are how the results look like. So in the equipment washing room, in the first room, they were able to push down the microbe levels by 47%. In the material airlock, they were able to push the levels down by 37%. But what's really great is that in the adjacent production area that we try to safeguard with this system, they observed 90% reduction of contamination entering. So based on this study, we can say that equipping these airlocks with spectral blue has a significant effect on the amount of microbes that can enter through the airlock to the production area. The bacillus and spores were tested also, but the calculated amounts were so tiny that it's difficult to say or show a statistically significant effect, but we didn't observe any bacillus entering after the test. Then the last case is Philips Medisize. The first two clean rooms were GMP certified clean rooms. Philips Medisize is a global company that does CDMO services for medical device companies. In their Finnish facility, they do injection molding plastics, which will be used in these medical devices. And while the operations are based on ISO 8 class clean rooms, they still follow many of the GMP guidelines in these areas, and they do continuous microbial controlling. And they had a bit different research question. They wanted to test in a material airlock, but they wanted to see that would it be possible to reduce the amount of chemicals or chemical disinfection if they install spectral blue, and how much money they could save by doing so. So this is how the setup looked like at Philips Medisize. So we have a simple material airlock. You enter from the left-hand side from the corridor. You bring the materials in, and then you exit. And then from the production side, from the right side, other personnel comes in and takes the materials to the production. So in this room, the total microbe count is continuously monitored through surface sampling and air sampling. And normally they would clean and disinfect this room manually 5 times per week, so every working day. For the test, they installed 4 of our fixed installation L100 devices in the ceiling, and they reduced the times, how many times they do manual disinfection in the room. They took samples before and after turning on the spectral blue devices. The before samples were taken during 1 month, or a bit more than 1 month, and the after samples were taken during 1 month afterwards. And when they did the after samples, they did the chemical disinfection was done only once per week. So they went from 5 times in normal use to just once per week with the blue lights. The air samples were collected from 2 sites near the doors, and surface samples they took from several sites around the room, from the walls and from the floor. And this is what the results look like. So by using blue light, spectral blue in this area, they showed that they could keep the same hygiene level. They could stay well below their alert threshold levels with blue light, even when they reduced the amount of chemical disinfection by 80%. And after the test, they have continued to measure the effects, and they have shown that the performance has stayed the same. So they have been able to change their process and to reduce the use of chemicals permanently. So they are now using this as a production method. And like they say in the quote, that they're really happy with the results, and they are looking at next areas where to implement it. So thank you. That concludes our presentation about the 3 customer cases. And now I will hand the microphone back to our moderator. Karin, please.
Yes, thank you, Tuukka, Camilla, and Michelle. And first, before we go to the questions, I just want to mention that these customer cases and also from other areas, from laboratories, from healthcare, from etc., are also found on our homepage, spectral.blue. So if you want to go and look at customer cases, you can find them all there. So let's start with the questions. There is one in the chat, and this is for Camilla. So do you have any experience on blue light affecting an ingredient, so raw material properties, or can it be considered having purely a surface cleaning effect? I guess this should be evaluated in the risk assessment. So I think this question is about if we can also, if it can have an adverse effect on the raw material, but also if it can have an disinfecting effect on the raw material.
Yeah, well, without knowing more about what types of material we are talking about, in general, we know that blue light is safe for most materials, but if you have biological materials that are light sensitive for some reason, so if they are sensitive to white light, visible light, they will be sensitive to this technology as well. But there are usually ways also that you can protect your samples or your materials, again, depending on what we are talking about. But perhaps if there is more questions about this, you can also contact us in person and we can try to answer them for you.
Thank you. So also the one who has asked this question in the chat, if you want more, you can also write, of course, in the chat if you want, if we understood your question right or not. There were some questions sent to us also by email before the webinar, and one was around Annex 1, and I think that Camilla already answered some or the question partly. But there was also a question about the periodic use of sporicides and if blue light can be considered a sporicidal agent.
Well, that answer is simply no. We cannot claim to be a sporicidal agent at the moment.
Okay. And then there is a question for Tuukka. So how can the user prove that the dose has been sufficient, and can it be measured? And can the user also notice if the power starts to decrease, the power of the device? starts to decrease.
Yeah, when we do a simulation for the customer, as we always do for each customer case, we make sure with the computer simulation that when we place the blue lights in the room, that we get enough intensity on the target surfaces. And after the installation, we can also measure that this happens in real life, that we get enough intensity on the surface. So then we can be sure that you get the dose in the time frame that you have specified. Is it 8 hours or 4 hours or during the weekend or whatnot? So we can be sure that you have the right dosage. And the LED technology, the LED components are quite well known to this date. So we have quite good statistical grasp of what is their life cycle and what is the expected lifetime of this kind of devices. And we can quite safely say that they will run for up to 50,000 hours. And the good thing about blue light is that you can see it visually, that if it's bright and blue, it works. And if you have problems with LED components, they will typically either flicker or they will be dramatically less intense. So you will visually see it yourself. But to be sure, we also offer a service that we can come, for example, every year and measure your devices with an illuminance meter. And you will get an audit report of the measurement. That's part of our service.
Okay, thank you. There is a new question also in the chat. So there's a question about where to have the blue light. So would you recommend to have the blue light in the personnel lock if the place don't have an airlock between the personnel lock and the clean room? So if there is, yeah.
Yeah, I think that if you don't have an airlock, but there is a personnel, I guess kind of a changing room or something, I think those are also really good areas where you can install the blue light. Because even though it's safe to use when people are present, it's very high intensity blue light, and it's perhaps not it's not very nice to work under the blue light for long periods of time. But where you go and change your clothes, these kind of changing rooms or personnel locks, they are usually not used for many hours during the day. So that means that the blue light can be on for most of the time, and make sure that when somebody has entered the room and perhaps brought some contamination with them, that will be taken care of, and it will minimize the risk of spreading to production areas and other sensitive areas. So yeah, it sounds like a good place.
Yeah, and here also, of course, with the motor sensor or the presence sensor.
Yeah. Yeah, it's possible to use a presence sensor or a clock module or a manual switch, whichever you prefer.
In the mail that we got before the webinar, there was also a question about resistance, and the question is, are there any bacteria, virus, or spores that are resistant to blue light?
Answer is no. To this day, there is no sign of any resistance towards blue light, and it's also considered quite difficult for the microbes to develop the resistance towards blue light. But having said that, no one can state for sure that that is never ever going to happen. But right now, there is no resistant microbes, and this technology works really well on the strains that are resistant to antibiotics or biocides or UV light.
Thank you. There was also a question in the chat about if these webinars, where they can be found, and if we can, if one can watch them afterwards. And I did add the address in the chat, and also here on this slide you can see it. So if there are no more questions, then of course, if you have any questions or comments or want to discuss with us afterwards, it's just to contact us. Here you can see now also that we will have 3 more webinar sessions this autumn. So in 2 weeks' time, we will talk about blue light in laboratories and especially in biosafety cabinets. After that, in November, we will have a session on the food industry and food safety. And in December, about healthcare and ambulances. But as I said, so the 2 webinars that we have already had, this one and the general one we had 2 weeks ago, will be found on our homepage under webinars. And this is also a place where you can sign up for the coming webinars. So thank you, and I wish you all a lovely rest of the day and a sunny autumn.